Welcome back to Weekend Live. Now it is time for our Sunday political panel. Joining me is Ebony Bennett from the Australia Institute and Renee Gorman from the Institute of Public Affairs. Good afternoon to you both. Thank you for joining me.
Good afternoon.
Good afternoon.
Let's get straight into it. I want to begin with aged care. We saw on Friday last week that Minister Richard Colbeck, his appearance at a Senate inquiry, at the time he couldn't say how many people in residential aged care had died of COVID-19. Ebony, Labor has really seized on this, particularly today, calling for him to apologise. Do you think that this warrants an apology?
I do think it warrants an apology. We all forget figures from time to time, but you should be prepared when appearing before a committee like that, particularly if you're the minister. And let's face it, there have been far too many deaths in residential aged care. Colbeck is responsible under his watch. So he's got many reasons to apologise, but the real issue, I think, is not fumbling over the figures, but the number of deaths themselves. The federal government really has to pick up its act. Aged care has obviously been a disaster for several years now, and this pandemic has really just exacerbated all those existing problems. The Royal Commission's hearing about malnutrition, maggots in wounds, and now we've got an aged care sector unable to deal with outbreaks of community transmission, and it's getting into aged care homes that the federal government is responsible for. That's the real issue here, and I think that's really what the minister needs to get on top of, or get out of the way for someone else who can.
Renee, the Prime Minister has already come out in the last few weeks apologising for the current aged care situation, acknowledging that mistakes were made. We now see Minister Richard Colbeck unable to answer questions himself. Does it give Victorians much hope when you've got ministers that are forgetting basic facts?
Well, I think there are a lot of things that are making Victorians lose hope right now, but I think most of those things are focused at the state government rather than the federal government. But I do think we need to remember that this is not a partisan issue, as many in the media and the union movement are trying to make it out. The coalition supported practically all the Rudd and Gillard reforms to the aged care sector, and Labor largely supported the Abbott government's move to the consumer-centred care changes, which is funded on the NDIS model. The narrative that government-run facilities are safer and that private centres are motivated by profits is false. Only 4% of aged care facilities are run by governments, 55% are run by charities, and 41% are run for profit. The federal government fund, regulate, and there definitely are some problems there. But you can't simultaneously say that the government has done a poor job regulating these areas whilst arguing for more government intervention and control. What we need is better regulations that are actually enforced.
Well, no doubt there'll be more on this when Parliament does resume this week. I want to talk about one of the key areas or issues that came out of National Cabinet this week. The Prime Minister is seeking clarification on hotspots. Ebony, of course, the border battles, it's a long-standing issue now, but in a number of these towns, there's people not getting the right medical care. Farmers are really struggling. How important is it to seek clarification as soon as possible?
Yeah, I think there's two separate things here. The hotspots is about consistency for when, it's a place is declared a hotspot. But really what the Prime Minister is worried about and what's causing the problems is these state border closures, which were popular with the public. But as you said, causing a lot of problems for business as well as individuals. And I think really the only way that we're going to see some real change here from state premiers is probably once they start hearing from their own business communities. And I take up just the agricultural workers here. It seems like there's greater clarity for travel and border arrangements if you're a Pacific Island worker coming in to, for example, pick mangoes than there is if you're a shearer from Victoria looking to shear a sheep in New South Wales. So those kinds of issues really, I feel like should have been resolved well before this, but I think that's going to be one of the key things for National Cabinet to sort out in the coming weeks, and it's just a shame that hasn't been sorted out before now, but you can certainly understand when state border closures are so popular that the premiers are reluctant, not just because it's popular, but also because it's reducing community transmission to keep those in place.
Absolutely, and you can see the popularity, particularly in Queensland and Western Australia. Both of those states, of course, coming up to elections either later this year or next year. Renee, this week, Peter Dutton, he has said that the Queensland Premier is playing politics on the border closure. Do you think that there is an element of politics at play?
Well, I do think that Peter Dutton is right to be concerned, and I think we should all be concerned when a state leader says something like, in Queensland we have Queensland hospitals for our people, like the Premier said the other day. Having no exemptions for medical emergencies especially is heartless and is affecting the people that need the most care. As we saw last week, when a woman almost lost her baby after she was denied access into a Queensland hospital for an emergency caesarean and was instead flown the much longer journey to. This made even more preposterous when the Queensland Premier is making exemptions for NRL players who are frequently crossing the border for matches. Now, I love footy as much as the next person, but I think that anyone can see if exemptions are being made for entertainment purposes, then they definitely should be made for medical emergencies, especially since there have been 0 cases in northern New South Wales where most of these medical emergencies are coming from.
Yeah, well, fingers crossed these sort of clarification as soon as possible. And now this week our Parliament will resume, and it's going to be an interesting one. It's the first time in our history that members and senators will be able to participate in proceedings remotely. One of the key issues already coming out of this, Ebony, is that they won't be allowed to vote on legislation if you are remote. There's going to be a number of issues at play this week, including introducing legislation to extend support to those suffering the most from the pandemic. How critical, though, is it that on this type of legislation?
Look, it is critical, and it's really, I think, appalling that the government hasn't sorted out, or that the Parliament hasn't sorted out how to sit during this pandemic, because the instinct has been to just suspend and shut down Parliament, and the government is making huge and consequential decisions that impact millions of people's lives, and that requires scrutiny from Parliament, and it requires that the whole of Parliament be able to participate. These are democratic decisions that need to be made, and if National Cabinet can have been sitting since March, then Parliament should be able to get its act together to figure out how it can sit during sittings and get legislation passed and really scrutinise the decisions that government is making. I will also point out that it'll be the Greens leader, former Greens leader Richard Di Natale's last week. He'll be giving his valedictory, I think, remotely. And it's a real shame that he'll be leaving the Parliament as a public health professional and a former doctor. I think he's been a critical voice on public health for things like dental care in Medicare, and it'll be sad to see him go, but I'm sure it will be odd to give a valedictory speech from, probably his lounge room rather than being in Parliament. And those new arrangements, I think, are welcome, but all parliamentarians should be able to fully participate in Parliament, and we should stop suspending Parliament and figure out how to let it sit and do its job.
Yeah, and Renee, I mean, does that raise questions about transparency when you can't have everybody being able to vote on what will be very key legislative measures?
Yeah, I do think it raises some questions, and I do have to agree with Ebony that I think it's absolutely ridiculous that our elected leaders cannot figure out how to do Parliament virtually and allow everyone to vote. There are so many examples of parliaments finding a safe way to sit during this time, and businesses across Australia have been able to find ways to work virtually, and children as young as 6 years old are using technology to communicate with their teachers and do school from home. So the idea that they can't figure this out while they expect everyone else to do it is absolutely ridiculous. And I can only hope that this will improve and that this example will pass on to the Victorian government, because Daniel Andrews has suspended Victorian Parliament for far too long, and there is absolutely no excuse for this. Parliament can be done in a safe manner, and if anything is an essential service, you would think that our democracy is.
All right, just quick final word from both of you. I just want to touch on the vaccine. This week the federal government signed a letter of intent with drug company AstraZeneca to supply a COVID vaccine to Australia. Labor has said that a letter of intent is not a deal. Do you think that Australia has been too slow to act on the matter?
Look, I don't, that's hard for me to say. I think obviously we want the government to be doing everything it can to secure a vaccine wherever one might be successful. But I did think this was a bit overblown in terms of the actual announcement. I think Labor's right that a letter of intent is still pretty far away from a vaccine. And, we've seen a history of the government kind of over-promising and under-delivering. They had a $40 billion underspend on JobKeeper. They've got a $250 million arts and entertainment package that still hasn't been spent for the most part. And so a vaccine announcement like this, I think, while welcome, and I hope that they're pursuing them with other promising vaccines as well, I don't think we want to count our chickens before they've hatched, so to speak.
Yeah, a fair call. Renee, what are your thoughts? I mean, obviously a bit of optimism, but want to see, I guess, pen to paper first, would you say?
Yeah, and I think a lot of Australians are relieved to hear that, a plan for a vaccine is in development, but we cannot rush a process like this, and proper testing has to be done to make sure the vaccine is safe and effective. And in reality, this is going to take months or even years. So the government really needs to have a plan B. Australians cannot afford to wait for a vaccine to lift these restrictions. So federal and state governments need to look at pathways to open up our economy safely before then. We really need to be looking at a new risk-based, proportionate approach to managing this virus as we move into the future, because we cannot rely on a vaccine that in reality may never come and could take years.
Yeah, I guess remains to be seen. Renee, Gorman and Ebony Bennett, appreciate your analysis. Thank you for joining me.
Thank you for having me on.